Okay, Abby.
Yes.
Um, this is a video we're going to take, and I'm going to put it on my Facebook and my web page.
Okay.
And so we're going to start out with, I saw you back in March 2012. And how did you find me?
Well, I had been to probably 20 doctors, which I can list the different types of doctors I'd been to, and I was actually approved for $100,000 sacral implant.
They were going to do a sacral implant?
Yes, I was approved for an InterStim device. But that wasn't my only problem. My pelvic area wasn't my only problem. I had thought that everything was stemming from my pelvic area and that I had developed a pain syndrome. And I knew I had a lot of I felt I had a lot of trigger point issues. And I felt that if I solved the pain or the electrical activity in my pelvis, that maybe everything else would go away.
So how did you discover this? What were you reading to find this out? Because that's how I think.
Right.
So what gave you that trigger point notion?
I had read a lot about trigger points with myofascial pain syndrome. I had been doing a lot with the foam roller, which talked a lot about trigger points. And so I had already had trigger point injections done. It was basically, I had vaginal trigger point injections done with lidocaine, but I'd also had some done on my glutes where I would always have a lot of pain, and and my shoulders. And that was done by a physical therapist.
Okay.
But it was only a few needles, and he was very inexperienced.
Okay.
So.
All right. So
To find you, I had come across you Googling a myofascial pain syndrome. Actually, there was something that you had said, I believe, on your website. You put that term in somehow.
Okay,
It was, and trigger points, actually, as well.
So before you came in March, how many years were you suffering?
I had progressive issues, widespread systemic issues for 4 years, and they varied. They would come and go, and it would be problems that would be for months, but then something else would come up.
Okay. Now, when you first came in, there was a list of the top issues:
Yes.
bladder, pelvic floor, constipation, tightness in your legs, tightness in your shoulders, burning headaches, burning sinuses, and pain in the gluteal area.
Yes, and that, remember my neck. I couldn't move my neck.
Okay.
I mean, I had a constant headache. The headache had become unbearable. I had been bedridden at least 2 days a week for the past month before I came here. And what I told myself is, you were actually my last resort. Before this, you were the only thing I hadn't tried, because I had been to numerous doctors, physical therapists, chiropractor. I was at just to quickly name, I had been to two gynecologists, one urogynecologist, 3 urologists, a neurologist, a what's the one that checks you for rheumatologists,
Okay.
and 2 family physicians. Just so that's the ones I can think of on top of my head, plus 4 different physical therapists.
Okay.
And when I came across you, I said, I'm going to try one more thing before I do that, because I'd already tried what I thought was like acupuncture trigger point injections, and that didn't really work. But your site seemed like it was more advanced, and that you knew. You also used the Travell, and I had read a lot about him, so I was interested in someone that actually knew about that.
Okay. Travell is the matriarch of myofascial pain therapy.
Right.
She is phenomenal. Okay.
Right. So that's also how I found you.
Okay. Now, with the complexity of all your problems, I'm looking 2, 4, 6, 8, 10, 12, 14, 16. We've seen you 17 times.
Correct.
So, and how do you feel?
I would say I was somebody I would have been completely disabled. Had I worked, I would have been on disability. I'm a stay-at-home mom, so that wasn't an issue for me, but I was completely dysfunctional. So that's how I came in. And now, I mean, I would say I'm from where I was, which was about 40%. I'm probably at 85. Which I consider I'm completely functional. It's just I say I'm 85 because there's still a lot of things I consciously have to do to keep myself well. But it's wonderful to be where I'm at.
Okay. Now, very important. The what you have is technically treatable, and it's just a process of going through the treatment process. I've kind of sped your therapy up by many times because you could tolerate it.
Right.
But we still have work to do, and as time goes on, you'll realize you'll need me less, and you'll have to focus on your therapy less, and you'll be free basically. So, would you recommend this type of therapy to other people?
Absolutely, and I have. I've had my husband in here. I've had my 14-year-old son in here. I recommended someone who had a blog here in Dallas. I've referred them here, and she's also a patient.
Okay.
And so, yes, absolutely.
Thank you very much.